Take a deep breath and hold. Hey there, as radiology technologists, it's our job to communicate effectively with the patients. It helps us follow all our principles, minimize patient dose, and minimize repeat imaging. Let's see why communication matters in our field and how it can be done poorly or effectively.
Hello, Mr. Johnson.
Yep.
How are you doing today?
I'm having some chest pain.
You're having some chest pain? Okay, and how long has this pain been going on for?
About 2 weeks.
2 weeks, okay. Do you have any history of smoking?
No.
Have you had any history of injuries, accidents, or surgeries?
I fell about 2 weeks ago.
Well, about 2 weeks ago? Okay, we'll make note of that here. I see we have a script for a chest x-ray. It's pretty simple. I'm going to walk you through it as well, okay?
Alright.
You can follow me this way. Alright, so what I'm going to have you do is just keep your chest flat up against this board. I'm also going to ask you to hold these handles to the right and to the left. And I'm going to give you some breathing instructions. What you're going to do is take a deep breath in and hold it when I ask, okay?
Alright.
Alrighty. So go ahead, take a deep breath in and hold your breath. And you can relax. Good job, sir. That picture came out great. And we're going to work on our next one.
This technologist has exhibited clear and concise communication, introducing himself, the procedure he will perform, and taking a thorough health history. When performing the X-ray, he provided good verbal instructions. Mr. Johnson?
Yep.
Hey, I'm calm. Taking your X-ray today. What seems to be the problem?
My right shoulder hurts.
Right shoulder? Well, I've written down that we have a chest X-ray. You sure that's what's wrong?
Pretty sure it's my shoulder.
Your shoulder? Alright, well, we'll take the X-ray regardless. I want you to come over here, stand chest against this board.
Okay.
Don't look at me. Hold your breath.
Right now?
Oh my God, I just took the X-ray, so now we gotta do it again. Why did you look at me? I need you to face the board. Let's do it again. This technologist does not communicate well. He didn't introduce himself, did not explain the procedure, and did not take a good history. He did not provide any verbal instructions, which can lead to repeat exposures due to a lack of cooperation and communication. Nonverbal body language is just as important as your words when it comes to being a good radiology technologist. Projecting a warm, welcoming, and understanding demeanor improves patient cooperation, leading to fewer repeats and less dose to the patient.
Alright, sir, we're going to be taking a few pictures of your hand. What I'm going to do is have you place your hand right over here. Alright. Now I'm just going to manipulate your hand a little bit. You can let me know if it hurts, okay?
Alright.
I'm just going to move it just
Right
like that. Oh, does that hurt?
Yeah.
Okay, I'll be more careful about that the next time, okay?
Mm-hmm.
Now I'm just going to move this over. What you're going to do is hold very still for me, okay?
Okay.
We're going to take an exposure and then we're going to work on another one.
This technologist used open body language, maintains eye contact, and offers reassuring gestures to create a welcoming and professional environment. They stand with a relaxed yet attentive posture, ensuring the patient feels comfortable and respected.
Hello. Hi, I'm here for an X-ray, X-ray of my hand.
Oh yeah.
Yeah, it hurts when I touch it over here.
Over here.
Yeah,
Alright, well, have a seat right here. I'll put your hand here.
like this.
No. Flat on the, look, flat on the table. Keep it flat down.
That hurts.
Don't move. Doesn't matter. We're gonna get a shot done, okay?
Okay.
Stay right there. Stop moving. This technologist appears distant, avoiding eye contact and using closed-off body language. He was impatient and, worse yet, showed inappropriate or excessive touching, making the patient feel uneasy and disrespected.
Fluoroscopy is another sensitive procedure that requires good communication. It's important to walk them through, give clear, concise instructions, give them the risks and the after effects of the procedure, whether it be a barium swallow or a barium enema. Alright, sir, today we're going to do a barium swallow study. Have you done a barium swallow before?
No.
Okay, we have some barium in front of us. I'm just going to hand you a drink. What you're going to do is hold it in your left hand, take a sip, and then keep it right back onto your left. Now, with this, you're going to experience some after effects, which could include nausea and vomiting. And after we're done with the procedure, you might experience some ashy stool, which is completely normal. But if your stomach irritation, nausea, and vomiting continue, you can please reach out to a provider or a doctor to take care of you, okay? Now, do you understand everything that I've said and explained about the procedure?
Yes, sir.
All right, let's continue. You're going to hold this in your left hand, and you're going to take a sip when we ask, okay?
All right.
This technologist approaches the fluoroscopy barium swallow study with preparation, professionalism, and patient-centered care. He greets the patient warmly, explains the procedure in detail, and helps alleviate any anxiety. The patient will leave feeling informed and cared for with the support of a skilled and attentive tech.
Hello.
Hey,
Hi.
have you ever done this before?
I don't even know what this exam is called.
You'll figure it out. All right, just have your bag insert.
Okay, like
Here's a drink.
what is this? What's in here?
I don't know. Barium, I think.
Okay. Will I have any side effects or?
I'm not really a doctor. I kind of just take the picture, so.
Okay, well, I'm very nervous. Is there anything you can do to help me out with this?
Not really.
This technologist enters the procedure unprepared and disengaged. His attitude may come across as rushed or dismissive, creating confusion or discomfort. This not only puts patient safety and diagnostic quality at risk, but also reflects poorly on the department.
Different patients require different approaches of care, especially with pediatric patients. Communication should be caring, age-appropriate. Technologists should involve the parent in the procedure for the child's support and for the parent's reassurance. And in return, you will reduce repeats and reduce patient dose.
Hey there, my name's Kyle. I'm going to be taking your x-ray today. Are you Dad?
Yes, I'm the dad.
Great, nice to meet you. And what's your name?
My name's Kyle.
Kyle? Wow, we have the same name. Kyle, can you tell me your date of birth?
Date of birth September 19th, 2022.
Alright, so what's wrong with Kyle here?
He's been having this cough for well over a week now. It's getting everyone sick. We've had enough of it.
Okay. Understood.
Is it gonna hurt, Mr. X-Ray Man? I don't want it to hurt, Dad. Just relax, Junior. Just relax. I'm sure it's gonna be fine. Could you just explain to the kid that everything's gonna be okay?
Not to worry, Kyle. The procedure is completely painless. Will only take a few minutes.
Thank you for that. See, I told you everything's gonna be okay.
The one thing I ask from you is to try to not move as much as you can. And if you do happen to squirm too much, we might have Dad come in and help out. I do have an extra lead apron he could wear, if needed.
Alright, not a problem at all. You hear that? Just don't squirm, Kyle. Just stay still. Alright, so you ready to get started? Alright, let's go.
I want you to be mine again, baby. Is this the kid? What's your name?
This is Kyle Jr.
Are you the parent?
Yes, I'm the dad. Nice to meet you.
Yeah, nice to meet you too. Listen, just make sure your child doesn't move. I'm gonna need you to actually leave the room, but tell Junior here to just not move while I do this x-ray, or else it's not happening.
Well, can I stay with Junior here? Like, in case he gets scared?
Can you stay with him? I mean, like, I guess, yeah. Yeah, hold on. It's gonna just be another few minutes. I gotta go grab the lead from the other room.
Is this safe? Like, I don't know. I'm getting a little worried. Is this safe for him?
Well, I mean, technically x-rays have been known to cause cancer, so, yeah, it's pretty dangerous.
Yeah, maybe we don't need this.
Careful attention must be considered when interacting with patients from diverse cultural or religious backgrounds. For example, a patient from a conservative religious background may require extra consideration for modesty during imaging procedures, such as offering them a gown or allowing a chaperone. If a patient is unfamiliar with the process, explaining the procedure in simple terms or offering an interpreter for language barriers can help avoid confusion. A good X-ray technologist will do their best to explain and conduct medical procedures in a culturally sensitive manner.
As you can see, good communication is just as important as setting your own techniques when it comes to reducing patient dose.
Patient safety is largely dependent on how well you can navigate verbal and body language.
With that in mind, we're now ready to put the RAD
In radiologic dose reduction through patient interaction and communication cooperation.